Psychology is all around us. Psychological elements can be seen throughout the lifespan, from birth until death. Films are a wonderful tool to explain psychological theory and occurrences in our lives. Characters interact within each frame of film psychological concepts. The films we remember most and view multiple times engage us by capturing the presence of these psychological dynamics in an authentic way.
Join me today, Dr. Katherine Marshall Woods, licensed clinical psychologist and film consultant, and my guest today, Dr. Anca Vaida, regarding her television show, Psyched, to discuss the best psychology in film. Hi, Anca. Thank you so much for coming on today.
Hello, and thank you for having me.
It's really exciting to talk about your television show, Psyched, which is being featured in film festivals currently. This television show, which we generally do not cover on this show, this show is called Best Psychology in Film, but I thought that this television show was very appropriate to cover because of the nature of what you're talking about in the television show. So why don't you tell us a little bit about your production?
Yes, so Psyched is a TV series, but more specifically a medical drama based entirely on psychiatry. So besides being a writer, director, actor, I'm also a consultant psychiatrist. And I've written this series based on my experience of working in the NHS in London. And I guess it shows a community mental health team and the patients they interact with, the professionals. So it's very much like Grey's Anatomy, for example, but in the field of mental health.
Why did you feel like it was important for individuals to get this landscape of mental health treatment? I mean, you just mentioned it's like, Grey's Anatomy. We've had medical dramas before. Why this one exactly?
We've had lots of medical dramas, but none of them strictly about psychiatry. And I feel it's a really important topic, especially as there still is a lot of stigma attached to mental health and mental illness. So I wanted through this series to portray an accurate model of what people suffering from mental illness are, how they present, and kind of show them in their complexity as people, if that makes sense. And at the same time, also look at the professional itself, because it's not only patients, but also professionals that sometimes experience a lot of stigma from other medical professions, for example.
Can you say more about that? That's really interesting.
It's difficult. I don't even know where to. But they're always like, for example, there is a strong drive in the UK to convince medical students to go into psychiatry because very few do want to pursue that career. So there is, people don't want to become psychiatrists generally. And I think it has to do a lot with, again, the public perception and maybe what we see in films. Because if you think about a lot of the films that show mental illness, the professionals are portrayed in quite a negative way, even thinking like One Flew Over the Cuckoo's Nest or Girl Interrupted. They are not portrayed in a good light.
Absolutely. I mean, I can think of a number of films, some that you mentioned, where psychiatry, psychology, mental health globally is portrayed quite negatively within films, and particularly when individuals are trying to seek care and seek help. That psychologists, psychiatry have actually been individuals who further abuse their patients or take advantage of them in some way, try out different prescription drugs on them. And so it leads patients to really feel like receiving care from institutions and organizations in particular can be actually a quite unsafe experience rather than the safety and haven that they're really searching for. So I can very much understand where you're coming from, and that's also in the US.
Is it?
Yeah. Mm-hmm.
Yeah.
So you have created this experience for individuals to take with you within this drama, and it is quite compelling. This story. Tell us a little bit about the characters.
Uh, so the lead character is a consultant psychiatrist, attending, I think it's in the US. And we follow her story as she meets the patients, and we see a side of hers that is very kind and caring, very knowledgeable. And at the same time, we also see her in her personal life, which is the complete opposite. So very chaotic, messy, even promiscuous to a point. And I feel that kind of shows the humanity of it all, that everyone is flawed, but it doesn't mean that they don't do their best or try to do their best. So that's the main character. There is another important character who is a junior doctor, and we see him starting in this career and taking his first steps and the difficulties he encounters. We follow these two characters throughout the season. But at the same time, a lot of the main characters, so to speak, are the patients. And I wanted to have it a bit different than how it is in other medical dramas, where you meet a patient in an episode and then you find out all their story in that episode. Because in psychiatry, and especially in community psychiatry, we find some of the same patients many times as time passes. We meet them when they're well, when they're unwell, they get better, but sometimes they have relapses. So I wanted to show that as well. So throughout the season, we meet the same patients in different moments of their lives, as well as of their mental health.
I do think that that's a really important message to offer to audiences, truly, is that when one comes in for mental health care, the mental health professional is unable to learn everything about them within one sitting, that the actual process of mental health care unfolds over time, and that is actually a natural evolution of the work that we do. It would be hard for someone to be able to capture and express and articulate to a physician or any type of doctor who they are in their entirety in 50 minutes or an hour. Who they are is much more complicated and requires a lot more time than that. So one therapy session or one treatment session is insufficient for healing to occur. It could feel very much like a healing experience, but it's not sufficient for true long-term healing to have occurred. I think that happens in the way you've articulated that within your work is really poignant for people to see.
Yeah, I think so.
You know, one of the things that I also noticed about Psyched is that you bring in the institutional third, this idea that you work in an organization and what's it like working and serving in an organization. Can you share why that was also important for audiences to glean from your work?
Yeah, it's very well noticed, because yes, indeed, it was something I also wanted to highlight, because especially in the UK, the national health system has a lot of positives that I wanted to be seen, but also some obstacles that we face in our everyday practice. And I kind of wanted people to see those sides as well. Yeah, but really, really well observed, because indeed it was part of my focus when writing it.
You know, I really think that gives your audience a nice view that we are people within this organization. We have to serve the organization, and they house us to be able to provide the services. And when working with organizations, it has both some freedoms, and it also comes with some boundaries in what we can do and how we can do our work. And so it's interesting that despite your desire as a psychiatrist to engage or treat a patient in the way that you'd like, there's still some boundaries and legalities, even laws that says otherwise, and how we try to navigate that as well and be able to still serve our patients.
Absolutely. It makes me laugh because we're still in post-production with some of the later episodes, and I fed back on one of them today, and it's exactly what you're talking about. And I know you haven't seen it, but you're really like, yeah, it's exactly about that.
Well, this is very nicely done to be able to show people what it can be like for the psychiatrist working in the treatment location, but also, like you're saying, what it's like for a patient to be there as well. I have to admit, your character, your lead, takes a lot of risks. And so I'm wondering, is that typical, do you believe, in psychiatry as it's portrayed?
I don't know, in the sense of, I feel very strongly that we should be led by the patient in particular, in the sense of led in the sense of providing care that is very specifically tailored to the individual, and what works for one person might not work for a different one. So from that point of view, if that's what you mean about risk, that's what I very strongly believe in, that we need to tailor it to each individual.
I can imagine that would bring comfort to patients to hear, is that therapy and mental health care isn't a recipe, that we don't have, let's say, a book that says this is going to fit for you, it's going to fit for this person and another person, that it does require, like you're mentioning, this tailoring, this individualized approach, that our goal is to see the patient for who they are and then be able to determine what sort of interventions can be helpful to them, versus just coming at it in a one way, which may not work for everyone.
Exactly.
If you had it your way, what would you want people to take away from your television show?
I think I've used this a few times, the word, but I feel like the humanity of it all, the humanity in the patients, the humanity in the staff working with the patients, and to kind of see that we're all the same in certain ways, different and beautiful individuals, but also the same, and to kind of take away the fear, which I feel then would help combat stigma.
Mm-hmm. Well, let us come back in a moment after a commercial break, and we'll continue with talking to you about Psyched. We'll be right back.
I don't know why you're so sad. You've got a roof over your head.
Bro, you gotta stop with that depression stuff. That's a white people thing.
Escúchame, en esta casa los hombres no lloran.
You alright?
It just feels like it's coming from everywhere.
Do you want to talk about it?
Thanks for hearing me out, bro. Appreciate it.
You can talk to me if you're feeling sad. Whenever you need to talk, I'm here, okay?
Hello, I'm Dwayne Jones. I'm thrilled to introduce you to the University of the District of Columbia's College of Agriculture, Urban Sustainability, and Environmental Sciences Causes. Established in 2011 and launched in 2012, UDC Causes stands as a beacon of transformative education. Our diverse academic programs nurture leaders of tomorrow. Causes is committed to providing land-grant opportunities that empower communities and foster a more sustainable and resilient future. This year, we're celebrating over a decade of Causes impacts with our theme, Telling Your Causes Story. Each story is a testament to the power of education, the strength of community, and the impact we can make together. Causes is a journey of growth, discovery, and making a difference.
We are so excited to have Anca Vaida here to be able to talk about her television show Psyched, which actually was created in the UK. This show is so fantastic in being able to show individuals what it's like in order to be a patient as well as a mental health provider within the UK system, and can be very translatable to here in the US. Thank you again for coming on our show.
Again, thank you so much for having me.
So one of the things that I noticed is that, and you mentioned before earlier in the episode, is that your view is really to be able to hit on stigma of mental health and be able to be a part of contributing and reducing that, which is very, very admirable. It is a cause that is really important to be able to invite individuals into therapy, into mental health that may feel uncomfortable coming. And one of the things that I noticed in your show was that you have individuals who are of color. And I'm wondering your thoughtfulness behind that.
Yes, that was a very important aspect for me to show for several reasons. The main one being that London is such a diverse population, and I wanted the show to represent that. I wanted to show exactly the kind of people we work with on our everyday journey. Also, one of the things is that we know that sometimes the stigma is even worse in some communities. So maybe people seeing a representation of themselves on screen might help combat the stigma more. And also, I think I've mentioned this to you, also looking at it from a point of view of an actor and director, I know how hard it is for people who come from immigrant backgrounds, people of color, LGBT community, how hard it is for them to get cast in different roles. And I felt like I want to create this opportunity for those people to be involved. So, yeah.
Yeah, and I also want to highlight, just for those who will be watching the show soon, is that when you said the people who we work with, that the people of color are not just individuals who are patients, they're also colleagues. And so that they're shown in various different ways of navigating the world in mental health. So it's not only individuals of color who are patients who are being treated. And so I thought that that level of diversity was also worth noting.
Yeah, absolutely. Just like real life, isn't it?
Yes, that's hopefully the goal of what we see on television and in media per se. And, you know, the drama of it all can ask individuals to really hone their work in a very different way, that it doesn't really reflect reality. Are you ever pulled as a creator to create stories that don't necessarily reflect reality in order to get more from the audience?
Well, so far at the level that I'm at, I've had creative control. So that allowed me to tell the stories that I wanted to tell. I don't know what the future holds. It's going to be an interesting thing to navigate. But at the moment, so far, because I'm writing, directing, producing most of my projects, I've had the ability to say the stories that I wanted to say with the characters I wanted portrayed and how I wanted to portray them.
What is the future of Psyched? Where do you want it to go?
I don't know. Ideally, I would like it to go on a TV channel or on a streamer like Netflix, Amazon Prime. But I don't know yet. So the pilot is the one that has been doing the festival rounds, and we have over 50 awards and official selections at the international film festivals. And then episodes 2 to 8, which are the rest for the first season, are currently in different stages of post-production. And once it is all finished, so the first season, I want to try and see if we can pitch it to some TV channels. And then fingers crossed, maybe seasons 3, 4, 5, 6, because I have a lot of material here. But we'll see. Fingers crossed.
Fingers are crossed. Congratulations on all of the accolades that it's receiving. It's certainly well deserved, given the content and production that you're doing. When you said lots of material to offer, and of course you're doing all of this work in the art of creating, are you also a practicing practitioner?
Yes, I am still a consultant psychiatrist. I work almost full-time hours in London in a community mental health team. So, yeah.
Are they ever afraid that you're using the content and material in order to gain new episodes?
No, not really, because they know it's all fictional. So, yeah.
Yes.
But everyone is very excited, keep asking me, when are we gonna be able to see it? And I'm like, just have a bit of patience, post-production.
Yes, post-production always takes time, certainly. Well, I am so excited that we were able to have you on today. I know it's been a long time in order to get on schedules because of both of us being practicing practitioners, and that patients require us as well. And so this was such a joy to be able to introduce Psyched to our community in hopes that we will be able to see it soon. So then people are able to get a sense as to what is it like in order to begin to get treatment in a community mental health clinic. Who are your practicing clinicians and who are they as people? What is the institution going to be offering you? I definitely feel like the nuances that you offer the audiences regarding receiving care, that anyone has the opportunity to be able to receive, is just so great. Thank you so much for this work. I am so hopeful that the mass media will be able to get to it. The mass public will be able to get to this media.
Thank you so much for your kind words.
Well, we will look forward to seeing it soon. Thanks so much for coming on, and thank you so much for joining us today. We will see you next time on Best Psychology in Film. If you'd like to get in contact with me, follow me on Instagram at Psyched Media. We'll see you next time. Bye.